Your doctor asks you a question, you give an honest answer, and you, my friend, may have just cost yourself hundreds of dollars.
If you don't know us, I'm Larry.
And I'm Hope.
And we're from Under the Median, where every week we bring you videos on practical frugality. Hope had a little experience at one of our local optometrists where she went in for an eye exam that's covered 100% under our insurance plan. But something changed, and I'll let Hope tell the story.
We need to start out by saying that we are not medical doctors. We are not offering you medical advice. If you have a medical situation and you need to consult a doctor, please, by all means, do so. We were done with the exam. Everything went fine. He said, do you have any concerns? Well, in every other exam through the years, he's asked me, do your eyes ever burn? Do they itch? And so I thought, oh, he hasn't asked me that. I should tell him my eyes are burning a little bit, here and there. And he said, oh, that sounds like dry eyes. So he did a couple of tests on my eye and he made a diagnosis. Now that's the word that you need to be aware of and you need to pay attention to. I was just diagnosed with dry eye, and that's where the problem was. I went up to pay my bill. Nobody at the front desk said, hey, by the way, your billing will be changed now because the doctor diagnosed you with something. It won't be billed as preventative care appointment. None of that was discussed. As far as I knew, the insurance would cover it 100% until yesterday when I got a bill in the mail.
We have better insurance now than we had before I retired. And because of that, we now have co-pays. But our old insurance was a high deductible. And had this happened a year ago, Hope would have been paying 100% of what is now an office visit to the doctor. Could have been upwards of $240.
Yeah. So how exactly did this happen? And what do you need to know about how to avoid having it happen to you? Before we give you our thoughts on what happened and ideas for what you can do to sort of arm yourself with information before you head into the doctor's office next, I'll tell you that on Facebook, on our Under the Median page, I posted this story and I asked viewers, tell me your opinion of this. What do you know about how billing happens for medical offices? And do you think that I should have been billed and have to pay basically my share of this bill? I have to be honest and tell you that it's standard practice throughout the United States what the optometrist did. Yeah. And I really do owe the bill. But we had some stories. Carmen said, I had this happen when a doctor and I casually discussed my weight. So Carmen's discussing her weight. The doctor just asks casually, and she told the doctor that she was working on some things on her own, didn't want to discuss any further options for weight loss. She gets the bill, and the doctor's office billed her insurance for weight management consultation. She challenged it with the doctor's office and got them to drop it. Krista has an interesting story as well.
Yeah, Krista says, I had a similar situation at a different eye doctor's office. I was also asked at the end of the visit if I had any questions. I said, I believe I have dry eye because blah, blah, blah. The eye doctor confirmed and said use drops, and then I was billed for a medical diagnosis versus just a yearly checkup. And that is exactly what happened to Hope.
Yeah, except Krista actually had done her own legwork. I didn't know it was dry eye. I just knew my eyes burned a little bit every now and then. She knew what it was. She had actually diagnosed herself, and then they charged her for confirming her own self-diagnosis.
They had a similar response to my disagreeing with their charge. So she ended up having to pay that extra charge on account of that incident.
Yep. Here's what Karen says. Karen knew the lowdown, guys. Last year when I went for my yearly, I didn't ask about anything. The doctor asked if I had any questions about anything. I said, nope, because I have seen a YouTube video about a doctor saying that if we ask anything about it, that you would code it as a different charge and charge differently. So last year after her exam, no charges before she would ask questions and then she would get a bill. That's what prompted me to make this video, guys. So this is not some sort of weird retribution video against the optometrist. You'll notice I didn't even say his or her name and the name of their practice. The reason for that is simple. This happens everywhere across the United States. Those of you in Europe, I cannot wait to hear what you say in the comment section, because I know many of you have nationalized healthcare, and I'd love to know your opinion about the kind of stuff that goes on in the United States of America. So let's talk in the comment section. But remember, guys, this is not politically based.
No.
Larry and I have been married 35 years, and we've seen a whole lot of Democrats, a lot of Republicans have passed through there in our 35 years of marriage, and this situation has remained the same. So the situation is not based on politics. It's based, we think, on some simple changes that need to take place at the level of laws that could fix this problem. We'll talk about those changes that we think should take place in just a little bit.
Yeah, it's basically a billing policy more
absolutely.
than it is anything else. And so Virgil says, sorry to hear you got caught with this. I'm afraid it's pretty common, and I suspect it is driven a bit by those who the doctors work for. My daughter-in-law took my grandson for an ear infection or something. When they were done, the doctor asked her how her other son was doing with an issue that had been seen a few weeks ago. My daughter responded, and when she went out to pay, they had charged her for a follow-up on the other son in addition to the one she had taken in. Unfortunately, it wasn't settled until she got very upset and refused to pay. This sure seems like something that should be stopped. And I agree with you, Virgil. That was ridiculous.
Carrie, who actually works in the medical billing industry, said, she suggests this: you can try to file a claim, an appeal with your insurance. They'll look closely into the claim. The appeal may be rejected, and the bill may go through as it is now. But you might get your claim or your appeal upheld, and it may be dismissed. Another note, anytime you go in for one reason, say seizures, if a doctor asks you if you have numbness in your legs, most doctors will code the claim because they have a diagnosis of seizures, and now they have a second diagnosis of numbness. Also, question the type of testing that they are ordering. You don't want to be treated for your numbness. Don't accept the referrals for nerve testing or CT/MRI. Save yourself several $100s. And she knows about this firsthand because she has been in the medical field for 30 plus years. She's done everything, guys, from front office to billing to office manager. And the doctor that she is an office manager for now deserves a round of applause because she said, this is a doctor that actually cares about the patients more than the money. Kudos to you. Thanks for your input, Carrie. That was super, super helpful. And this final bit of advice comes from a lady that I know personally and works in a medical-related field. She says most doctors are salaried and not independent. So it's not a matter of doctors trying to upcharge you necessarily and make more money, because most doctors don't. They get paid nothing different. And usually, here's the key, guys, the doctor's offices generally aren't responsible for their own billing. The billing and the coding is done by a completely separate entity, and they bill and they code based on whatever the doctor has written in the description field about the visit.
Our friend adds, so basically, don't go to a preventative visit unless you are willing to pay when or if a problem is found. And this kind of discouraged people from getting preventative visits. But it's the reality with the billing system today. One should go into a preventative visit expecting to pay a charge for an office visit. If they are lucky and nothing is found wrong, they won't have to pay, but they shouldn't necessarily expect that.
Here are some of the problems that we see with this. This is law-based. The reason that billing companies can do this is because of the laws that exist on the books right now. The problem with the law is that the patient has to know what he or she can and cannot say. We've already said it. If there's something that you feel you really want to discuss with a doctor, by all means, you should. We're not saying you should lie to your doctor.
Or hold anything back if there's something wrong.
Absolutely.
Yeah.
You have to be prepared, though, to understand and know that when you discuss something with your doctor, that will not be covered as a preventative visit any longer.
Right.
You have to be prepared. It's like our friend said, you got to go in prepared knowing you might wind up paying for that visit.
I guess what would be nice, and I think this is some of the point that we're going to make here, it would be nice if there was some kind of disclosure in the office, maybe some signs posted indicating that if there's something found wrong with you and they diagnose it, that you will be charged for it. There should be some way to let the patient know what to expect.
Let's talk about that. We have about a dozen different ideas. We really want to hear from you in the comment section. What do you think is a fair and equitable solution for this problem?
You really don't want to walk into your physician's office like you're walking on eggshells. And if the least wrong thing is said out of your mouth, then money's going to be slipping out of your wallet.
I told Larry, I feel like the analogy would be that you're on a tightrope, right? And you're walking high above the ground, putting one foot in front of the other. But the only problem is, I feel like unless you know the information we're giving you in this video, then you're walking blindfolded on a tightrope. And you have no idea where you're at, or where the rope is at, or where the rope is going. It's very, very frustrating. So in relation to what Larry just said, you don't want to say the wrong thing. I think part of what the consumer, the person who is paying the bills, needs to be willing to do. We tend to get intimidated by the letters MD or OD or whatever. Anytime there's a bunch of letters behind somebody's name, we go, oh, I shouldn't question them. They're probably smarter than me. Well, they know more than you do, but that doesn't make them smarter than you are. It means that they've had a field of study. Yeah, they've had a lot more education in the area. Yeah. And anytime you have a doctor that if he or she gets offended when you begin to ask questions so that you can understand what's going on, there's a whole nother level of problems there. You maybe want to find a different physician or be able to look that physician in the eye and say, I have questions I need you to answer. Don't be afraid to ask questions. That's point number one.
If you think a question is going to cause an additional billing charge, then don't answer it if you don't want to.
Yeah, and in that same vein, ask your own questions. Look the physician in the eye and say, if I answer this question with anything other than no, I have no concerns,
will I be billed
for it? Yeah. I think you have to go in there willing to ask blunt questions about billing, because let's face it, medical care is incredibly expensive. And I think that patients need to know and understand, and they should be valued enough to have that physician answer the question. Research, read and research. And don't be afraid to tell a physician, let me put some thought into that and I'll get back with you. Especially if a physician is saying, I'd like to do XYZ tests. And you don't want to take time within the appointment to say, tell me exactly what that test does and that sort of thing. Say, you know what, let me do a little bit of research on that and I'll get back with you or your staff with any additional questions that I have.
Don't pay anything until you've received an itemized bill. I mean, unless it's just a simple diagnosis. But if you have something that you're concerned with, and this is especially true with a hospital stay. When I was in the hospital, we asked for an itemized bill, and we found some charges on there that were not legitimate, and we had the hospital look into those, and they removed them.
What I saw on that bill was not itemized. It wasn't clear to me what I was paying for. And this was a very, very, very simple bill. Ask for an itemized bill. It will tell you exactly what you're being charged for.
When you have that itemized bill, also look for double charges that they might have put on there. That does happen. And make sure that you challenge those if you see that happening.
We would consistently get charged when Larry's at the hospital with his heart condition. For those of you who don't know, he had end-stage heart failure 5 years ago when a virus attacked his heart and left it barely beating. So
it was in pretty bad shape.
Yeah, we definitely relied on the insurance during this specific time of our marriage. And and they would have a registered dietitian come in and say, I'm supposed to help you with your diet. And I would look at them and say, we eat a whole food, plant-based diet. I avoid sugar, oil, and salt. And I make every single thing that we eat from scratch. And they'd say, I can't help you, and walk back out again. And I was consistently getting charged for these 15-minute visits from registered dietitians. And I called the hospital and I said, look, here's what happened, and I want that charge removed from the bill. The truth is, by the time we got that far, we had blown through our high deductible in about, 15 minutes after we walked in the hospital.
Yeah, $4,700 deductible. We went through that in about 10 minutes, I think, when I first arrived there.
And we weren't paying for this, but I think that it's completely unfair to the insurance company to have them pay for it either.
Sure,
so just because we weren't footing the bills didn't mean that I felt like I shouldn't have an itemized bill at my disposal. And so we got some of those charges dropped. There was a test on there too that I went, y'all didn't do this test.
Oh, it was a big test. It was an
big
expensive test.
And we said, nope, it didn't work.
It didn't work.
You didn't do it.
Nope. Here's something else you can do right after your appointment. Take detailed notes about what occurred in the office, what was said exactly. You may not remember 10 days out, 30 days out when you get the bill in the mail, but take notes so that you remember what happened exactly so you can go to bat for yourself.
Here's something else that I think is common as people get older, and that is take someone with you that can work as your advocate and can listen. Anytime we're in a doctor's office, it's stressful because sometimes we're getting news that we really don't want to hear in the first place. And so we tend to tune out. Whereas if we have someone else with us that is a trusted family member or a friend, they can listen on our behalf and say, no, here's what the doctor said. And they can sort of be our eyes and our ears, and a second person who is there present at the conversation.
You might also see someone who's not a specialist. Now, we're not advocating medical practices when we say that.
Nope.
But if the condition is not a serious condition and somebody else can address it just as well that maybe doesn't have MD or, doctor's credentials, but they can address it very well and they've got a good track record, do that too. That's another possibility.
We have seen nurse practitioners for several different medical type things, and it's had a wonderful experience with them. They don't have the MD, but boy, they really know their stuff, especially when it comes to certain medical conditions. So think about, do I really need to see a specialist for that, or can I get by with not seeing a specialist? Because a specialist is always going to cost you a lot more money.
And the nurse practitioners have had a lot of experience if they've been in the medical field for a long time. Find a doctor that has a yearly plan. This is a plan that covers yearly visits. It might include some lab work, etc.
You only pay one time, and then it covers a certain amount of this stuff. You pay in cash. The insurance is never billed. And the upside is you also know about how much it's going to cost you every year for your medical bills. And a lot of times they don't even have you pay the whole amount up front. You pay a monthly fee in order to be included in the program. I was aware of this. There's actually a doctor around here that has a thriving practice and does this. There's a name for it, which I did not know. And Julie, who is one of our viewers who is in the medical field, actually wrote an explanation of this that I thought was great.
She says, I'm in the medical field and I can say there are so many things wrong with our healthcare system. Insurance has way too much say, and doctors are no longer able to be doctors unless they move over to be a VIP doctor, cash pay with annual fee. I see more and more doctors moving over to VIP status because they are too sick of not being able to care for their patients. I am sorry this happened to you, she says to Hope about our situation.
The next suggestion we have for your next office visit, I think is a little controversial, but I'm going to say it anyway. Never allow your minor child to be seen by a physician alone. Now, there are a lot of different reasons for this, but what occurred to Larry and I is that you can have, say, your 16-year-old child go in and see the doctor, and the doctor's like, hey, how would you like this test? And they're like, yeah, I think that would be great. And all of a sudden, you're wind up paying this bill for a test that you did not consent to, but your minor child consented to, because the age of consent, especially in the United States, is being consistently challenged, and it's going lower and lower and lower. So for us, until our kids are 18 years of age and legally an adult, we walk right into the exam room with them, and we've never had a doctor challenge us and tell us to get out.
And once again, the same situation that happened with Hope could happen to your child. If the doctor asks, have you had this problem? And they say, yes, and then they diagnose it. Now that's going to change the billing for your child. So you want to be kind of in there to say, no, Johnny doesn't need to answer that question right now.
All right, here are our suggestions for how we think the law ought to be changed, because guys, we can talk about this every which way, and until we get to the legal solutions, nothing
Won't
is really
change.
honestly going to change. It's not going to be solved. All right, here's our suggestions. Make sure as we're going through these, we want to know your suggestions for the law ought to be ... Tell us in the comment section. Go.
Notices should be posted in large
Yep.
font on the walls of every examination room.
Yeah. And when the physician or the nurse walks in, she should say, "Did you read that notice?" Now, large font for people like us.
Big letters.
Big letters. So they make sure people like us can see that notice. But yeah, I think standard office practices. A couple of our viewers who commented on Facebook and gave us feedback pointed out that their doctor's offices are now doing this, and they think it's because like the medical malpractice people said you really need to have. But I love the idea because it's very clear.
Right.
When it's there and it's pointed out and you have to say orally, "Yep, I read that and I understand it," then there's no confusion. Because I feel like I was very confused about what I should and should not say when I walked into the office.
And we feel that the large font is very important at a vision care place, because why are you there for? I mean, you're there because you can't see very
You
good,
really
right?
couldn't see the notice. And that's why our next point is important. Verbal warning and consent should be standard practice. How much different of a situation would it have been when the optometrist, and I'm not coming down on the optometrist.
He's
guy.
a good, actually, he's a very
He's
good
a very
optometrist.
good at what he does.
Yeah.
We've been with him for years.
One of the best
and this
in our
is the
city.
first time we ever went, "What?"
Yeah.
And it's because there actually was a problem, and up to this point, I haven't had a problem. And so diagnosis equals changing the way that the billing is done. I get that. He's going to get his $50 from me. He can go out and have a couple, 3, 4 Starbucks, even take his wife out to Starbucks for that $50. I get it. But how different would this have been if he had said, "Now, I hear you saying that you have a little burning in your eyes. It could be a little dry eye, but before I look at your eyes and I make a diagnosis, I have to tell you, if I make a diagnosis, your billing will be changed. And if your insurance does not pay for a standard office visit at 100%, you will be responsible to pay the whole bill. Are you okay with me proceeding and examining your eyes for dry eye?"
Yeah, that
That's
would
it.
have
That would have
very
sufficed, and I
helpful.
don't think that is too hard, too much to ask.
Yeah, so basically, fees should be transparent.
I think there should be a list. Somebody tell me if you think I'm right. I do not understand why it is so hard to call an office and say, "I need to get this test done. Tell me what it's going to cost me."
Yeah, and offices should tell you when something's going to be
Yep.
billed differently
Absolutely.
if it's been changed from what you expected.
It is quite possible, however, remember that office does not know how it's going to be billed because they don't do their own billing. It's too complicated anymore. Insurance is like,
Yeah.
and so offices aren't doing their own billing, and it's the billing company's choice as to figure out how it should be billed. Now, having said that, if you can find a smaller doctor's office that still does their own billing, it is so much easier to contact them, talk to a real person who really works in their office and plead your case. You are pretty much going to get nowhere dealing with a large billing company because they've got too many irons and too many fires, and they don't care.
No, they just run on stats. They
Yep.
run on, this is the way it was coded, this is the way it came in, this is how we send out the bill. It's just that simple.
I was a little bit, all right, for those of you who are in the South, you'll understand when I say when I got that bill, my hair was a little bit on fire.
She was. I can attest to that.
A little highly elevated. Despite that fact, I was very cordial and very kind to the person on the phone. I said, "Look, I'm not mad at you. They only told you had to call and give me the bad news that you weren't going to rebuild differently and code it differently. I get that." But I said, what you also have to understand is this practice creates a situation where people are afraid to walk into a doctor's office because they don't know what they're going to be billed, and they don't know what that total damage is going to be to their budget until everything is said and done. And there's no way to actually for them to feel like they have any control at all over the situation. And she's like, I know, I get it. So I think, in relation to our doctor's office, everything's fine between us and our optometrist, but the situation made me think I've got to tell you guys what the lowdown is on what to say and not say.
And we don't want to have you feel like you just can't trust your doctor or your medical place. That's not what we're trying to promote here. But we just want you to be aware of this kind of thing, that if you step over and start getting into a diagnosis, that you might be charged for it.
This program is a little bit different in the way that we're approaching frugality and talking about it, primarily because we had never really faced this situation before and become aware of it. Now, if you want more ideas about frugality practices and strategies and tips and how you can actually save money in your monthly budget, there's a video right over there, and we'd love to share some more tips and techniques and strategies with you.